The Hippocratic Oath is an ancient Greek doctrine from the Greek physician, the father of medicine, Hippocrates. Many versions have been written, but they all reference the original. This ancient Greek doctrine has made its way into modern medicine. The oath begins with an agreement between practitioners to share knowledge between them. We do this here at New York Cancer and Blood Specialists. We share our knowledge between physicians, both formally and informally. We all have our own experiences through our practice, have dealt with different types of patients, different types of cancers, and sharing that information allows us to care for our patients in the best possible way. The Hippocratic Oath is one of the oldest binding documents in history. I am the son of first-generation immigrants from Greece. So I was born and raised in Queens, in Jackson Heights, which is the most diverse neighborhood probably in the entire United States. This diversity has stayed with me throughout my practice at New York Cancer and Blood Specialists. New York City has always been the melting pot of the world. After taking my oath as a medical student in my third year, I began my rotations. It was really the interpersonal relationships between the physician and patients and their families that really drew me to hematology oncology. I take care of one of the most ethnically diverse populations in the United States. Many of my patients are recent immigrants. Most are hardworking, work 6 to 7 days to provide for their family. Understanding their background, both ethnically and also culturally, as well as how their family interactions are, is an important part of how we treat these patients. It is important to understand that every cancer is different in every individual, but it's also important to understand that every individual has their own identity, their own needs, and that is a big part of my practice here in Queens. The field of oncology has changed rapidly in the last decade, and it was important that I evolve along with oncology. That's why I joined New York Cancer and Blood Specialists. New York Cancer and Blood Specialists has an extensive cancer network, such as radiation, radiology, and clinical trials. We have a number of patients with lung cancer, for example, who have EGFR mutations. We're able to use that mutation to provide them with a targeted drug just for that. And the responses are much better than what we had seen with the traditional chemotherapies. I remember my first day at the practice. It was great seeing patients and being able to provide them with immediate care, having direct access to medications instantly. That was a refreshing feeling, something that I had not experienced before. New York Cancer and Blood Specialists has the tools necessary for me to provide best and cutting-edge care for my patients.